I'm Kara O'Donnell, and this is County Board Wrap-Up, Arlington Television's monthly deep dive into the County Board's actions on issues that affect you, your neighborhood, and our community. As you can see, this episode comes to you virtually once again today, and joining me today from their homes are Arlington County Board Chair Libby Garvey and Board Member Christian Dorsey. Thank you both for joining us.
Thank you for having us.
And of course, this month, just like last month, we're going to be talking about the issue that's affecting each and every one of us. And of course, that is COVID-19, including the board actions from this month on reopening, as well as expanding support for our business community, as well as our residents who have been hit hard by the economic fallout of this pandemic. But we're going to start by talking about the reopening plan, the gradually getting into the area of phase one. And I guess the question that's on everybody's mind is, when is that going to happen?
Well, we did say, in our letter to the governor that I sent with a group of my colleagues from Northern Virginia, that the date is going to determine this, not the date. But I think we're all kind of aiming to the date of the very end of this month. And of course, the rest of the state has already moved into phase one. But we are, as I think everybody knows who lives here, Northern Virginia is a different kind of place than the rest of the state, very connected with the District of Columbia and what's going on in Maryland. And the virus has been much more active here. So the governor, and which I think was great last month, actually laid out the criteria for moving to phase one. And that was, downward trend in percentages in the number of cases and over 14 days see this downward trend. Number of hospitalizations, also making sure we had enough hospital beds and that we had some increase in testing and contact tracing. So it was clear a week ago when the governor was poised to move the state into phase one that we here in Northern Virginia really didn't meet any one of those metrics. Some of them we might, but we just really didn't even have the data. So we came together and our public health directors really and set out what the data was, and they all agreed and came to the elected officials, and we then attached their memo to us and to the governor about what was going on, and said, we're not. Here's the data, and we agree with your criteria, but it doesn't show that we're ready to move into phase one like the rest of the state might be. So the governor agreed. So the rest of the state has moved into phase one. And we're still at phase, I guess you'd call it phase zero. But I expect us to be moving into phase one pretty soon. And I'll invite Christian to say some things. We've got some indications that, I think we'll be ready to do that by the end of the month. Christian, anything you want to add?
No, I'm really supportive and proud of the region for coming together to actually stand up for what is happening here in Northern Virginia, so that we just didn't lump in the entire state together to really mask the unique issues that we were experiencing. And as much as we're proud Virginians and proud to be a part of the Commonwealth, we recognize that most of our residents have their mobility that goes through not just the Commonwealth, but Maryland and the District of Columbia. So to be ignorant and blind to that interaction would have been at the peril of everyone's health and safety. So the way we've proceeded has been responsible, and it looks like, as Chair Garvey has said, that we will be entering phase one relatively soon enough.
Now, what needs to actually happen for the county to hit those phase one benchmarks by the end of the month? What are some of the metrics we need to meet? And do you see any kind of indication that perhaps we would need to seek an extension for that? Are we on the way?
Well, I think we're on the way. Our hospitalizations have been going down, not fast, but they're on a downward trend. And we think the number of cases as well, although that may pick up as we do more testing. The really important thing that we were lacking here was this ability to really do broad testing to know what is happening, so we can make sure we get to the containment. And if you're going to do containment of the virus, you got to know where it is to contain it in, right? And we're about to launch in cooperation with the state on this coming Tuesday, testing at the Barcroft Community Center, actually there in the parking lot in the garage. And we're planning to do about 1,000 tests And people will not need a doctor's order. They won't even need to exhibit symptoms. And we're trying to get particularly folks who are underserved medically, may not have a doctor, may not have, but they are in, jobs that expose them to this virus quite a bit, and often living in tighter living quarters. And that's where we really need to be aware of where is the virus in that population so that we can start to contain it if we find it. So we're going to do a lot of testing that day, and I'm very hopeful that is the beginning of at least a weekly broad testing like that, because we're going to need to keep this up for a long time. We will be at the end of the five larger jurisdictions, Loudoun and our partners in Fairfax County and Alexandria are all going first before us and Prince William, and then we'll be doing it, and that's all being done in the space of about 5 days. 5 working days. And then hopefully we're going to just keep it going, because the whole region, again, as Christian was pointing out, we're really all in this together, and we need to be doing this kind of testing to know where that virus is, and then the contact tracing to follow up for people who test positive.
Now, one thing I think folks obviously were a little, it can be frustrating to hear the rest of the state is going to phase 1. We had to take a little pause there, but others are calling it an opportunity, and that's giving our businesses, our various entities, a chance to really prepare and make sure we're doing phase 1 right, so to speak.
Yeah.
What are some of the things that they can be doing here in the meantime to really prepare?
Mm-hmm.
That's a great question. And Kara, I'm glad you brought that up, because this delay, or at least the separate date from the rest of the Commonwealth, helps us actually plan to ensure that once we enter phase 1, we don't have to step back and impose restrictions later on, which would really hurt businesses. So this extra couple weeks, if you will allow businesses to start thinking about how they operate with reduced occupancies, how they think about maybe outdoor space as a way to expand their ability to promote responsible social distancing. It also provides them an opportunity to help get their workforce back engaged, to hopefully do what I would love to see them doing, and providing opportunities for them to do wellness checks when they have employees come and engage with the public again. So this really is, I think, an opportunity to get this done right, as opposed to what we're seeing elsewhere in the country, where people have hastily reopened. They've been overwhelmed by either demand or not having the workforce ready, and they've had to close down again. We don't want that at all. We hopefully want our businesses to enter phase 1, and then steadily we see an upward arc as opposed to going backwards and forwards.
And I think it's going to allow us more time to get the message out again. We don't have them yet, but we're hoping soon to have enough cloth face coverings for everybody in the county. And the expectation will be, all the businesses will be using it, all of our employees will be using it, and we hope every member of our public when they're out with groups of people. And it just gives us another couple weeks to kind of socialize that, hopefully get the masks. We don't have them in hand yet, although a lot of people have them, and there are ways of making simple ones. But I think, as Christian said, the crucial part is to kind of get prepared and do it right. Put down the marks. I mean, a lot of them we see, they're marks where you're supposed to stand, how you're supposed to do it. And we're doing a lot of work, I know, looking at where are there areas, say in the street, where we can push out and restaurants can do dining out, and maybe we take over a little bit of the public right away for dining. But we have to work that through carefully. And I think we're also working on signage. I think we may come up with some more creative kind of messaging out there about, one, where people are supposed to stand, how many people are supposed to be there, reminding people to wear face coverings. So there's a lot of work to do, and I can't guarantee we'll be totally ready when it's time, but we'll be a lot better prepared. So that's helpful.
All right. Well, fingers crossed.
Yes.
We are going to take a quick break now, and when we come back, we're going to ask the board members about that $20 million in federal emergency funds will be used for, as well as steps the county took this past month to protect low to moderate income renters living in committed affordable housing. Stay with us. Hello and welcome back to our virtual edition of County Board Wrap Up. I'm your host, Kara O'Donnell, and we're talking today with Board Chair Libby Garvey as well as Board Member Christian Dorsey about the steps the board took in May to support our community during the COVID-19 pandemic. We'll begin with some of the board's emergency resolutions extending the stay at home for Arlingtonians. And let's get started with that. Now, the board adopted what's called a continuity of government emergency resolution. Tell me about this. Why was it necessary?
Well, we already did it once, and it's just making it legally possible for us to meet this way. Like this broadcast we're doing, we do our meetings this way. Because a lot of the times it's been so clear that the Virginia Code and the Freedom of Information Act requirement, none of them anticipated an age of technology and none of them anticipated a pandemic. And consequently, we have ways that we can really function pretty well, but we have to make these legal actions to make sure that they're actually legal to do it that way. So we have to declare that there's an emergency, and that's why we're doing it. And it's also to ensure that our democratic processes don't get lost while we're doing this. That we actually maintain the continuity of government and the ability of our residents to participate when they want to, and our ability to be transparent and get information across. So that's all about, as well as to give the managers some authority to move quickly, because there were two different things we did, and nimbly. And we had a little bit of back and forth with our residents, which was good, because I think people are very concerned about how the Arlington way will continue. With the manager, in an emergency, they've got some things that he needs to do. If he had to come back to us and convene a meeting and we had to advertise it and do all this, it would take a long time. And sometimes in an emergency, you want to be able to right now allow people to do this, prevent people from doing that. So this gave him the ability to do that, but that does not mean he doesn't come back to the board. He still comes back to the board at the next meeting and presents things. So we do a fair amount of ratifying what he has already done and started doing. And that's helpful.
You mentioned the public participation angle. Now, has there been any concern that these virtual meetings may cut down on that public participation? What have you been seeing so far?
Christian, we've been seeing a fair amount.
I think there's always that abstract concern because it's different. It's different than the norm. But I think once people actually engage virtually, they realize a couple of really key things. One, you can stand up meetings much more quickly as opposed to scheduling them once every 2 weeks or 4 weeks. So if you actually need to connect with people, you can establish it within the parameters of the law a little bit more quickly. So you could actually have more substantive engagement there. So in other words, even though we're in a different time and we're using different media, doesn't mean that it actually has to result in lesser quality or lesser engagement. In fact, we can enrich engagement. And I think people are starting to see the opportunities with that. And, as Libby talked about all of the ways in which this resolution would allow us to function in the emergency, I want to highlight what it's called: continuity of government, not limiting of government, not reduction of opportunities. We really passed an ordinance so that we could continue to do all of the essential things that Arlingtonians have come to expect and love, but to deal with the world as it exists now, where we're not present with each other and we can conduct business virtually, and give the manager all of the flexibility to do what's required to keep people safe and operational during this time of change.
So,
but the board retains its authority, although I would say, Kara, I'm sorry I interrupted you, because there is the whole question of commissions. And I think Christian, I don't know, we probably ought to talk about that a little bit, because that is a slightly different issue that we're really still working through, I would say.
Yeah. I mean, I think we found a way to help our commissions. One, we've enabled them to be able to meet through actions of our ordinance and also our lobbying of the Attorney General and the Governor, whereas prior to those actions, they wouldn't be allowed to meet unless it were explicitly and expressly to deal with the emergency at hand. So we've broadened flexibility to have our commissions meet, but we run up against the real world limitation of we don't have the staff resources to stand up, fully produced video conferences for each of our 50 plus commissions who meet during a typical month. So we are having to have everybody prioritize their work to marry the necessity of their meeting with the very real staff limitations that we have. So I think we're going to work that out well, Libby. I'm optimistic. What about you?
Oh yeah, no, absolutely. Okay. It's just going to take a little while. We had a great presentation at our meeting, and staff had done it. And she was talking about how she'd had this wonderful Zoom phone call with her grandfather, and we all think it's so easy. Why can't we do that? And I pointed, well, if you're having a great, brunch with your parents or your family, you still don't invite the entire of Arlington County, which is what you have to do legally. Nor do you keep minutes of it, which is what you have to do legally. I mean, nor do you have to make sure anybody can access it, whether they have a hearing impairment or visual impairment or physical impairment. So it's very different. And we're all learning. I'm very optimistic. I think it's going to be better in the end. I really do, because I think in a way these meetings, this style of meeting does allow some people to participate who otherwise it would be a lot harder for.
Well, that actually brings me to my next question. When this is all over and we go back to normal, so to speak, we will obviously go back to having meetings in person, but do you think there will still be some kind of virtual element to do exactly what you said, to have the participation from individuals who just would never have done so before?
I sure hope so. One of the things our staff has looked at is when we review site plan applications. We've typically had our engagement take the form of people who show up at our very public site plan review committee meetings, which are absolutely essential meetings for people who dig deep into a land use application. But let's think about the broader community of people who would be interested and maybe have opinions about that land use application, who just don't have the wherewithal to commit to studying it and being in a deliberative process over the course of many weeks or months, but who nonetheless might have feedback that's important to consider and that would be valuable. And if we think about putting these concept plans up virtually and allowing people to walk through and understand projects using internet technology, and then to be able to provide comment or to make choices and display priorities, that would be all great. And I hope that that's something that sticks regardless of whether or not we are under restrictions or not, because it's a great way to expand engagement.
I think so. And I've been noticing some of our civic groups, like Committee of 100, it's been meeting for maybe almost 100 years now, 80 at least, at Marymount University. It's great to have a dinner and a speaker, and it's on a Wednesday night. And they've had a Zoom meeting here that I participated in there, and they had a lot. That was the largest meeting they'd had in ages.
Wow.
Because not everyone can on a Wednesday night pick up and go to someplace. And I've seen that happen in a variety of groups, civic associations, some other organizations and institutions that have been around a long time. And they're still, in many ways, modeled on the 20th century approach to the Arlington way. And here we are moving into the 21st century, and suddenly they're getting more people participating, particularly those who might have children at home, so they could participate in a meeting like this, but couldn't leave the kids at home alone, right? I mean, I just think the flexibility it's adding, I do, when I'm mostly positive, think we're going to end up actually in a much better place. It's a painful way to get there. But
yes. So maybe a kind of a combo of both worlds down the line.
Absolutely.
That really lets us think a little more innovatively.
Yeah. So. But you're still going to want to meet. I think we all want to get together in the same room and, toast each other or whatever it is
most
we do.
Most of us are eagerly awaiting that day.
Yeah.
Now, moving on a little, the board actually did also approve and appropriated $20 million in the CARES funding to help Arlington respond to the pandemic. Now, were you expecting this funding? Was it a surprise? And then, where is that going?
All right, I'm going to give the question to Christian, but I will first say when the federal government started voting on it, we saw it. We said, when is it coming? When is that? Are we going to get it? How much are we getting? So it was not a surprise.
That's right.
Christian.
The only thing that was at issue was the amount. And just to let you know, kind of the share that went to the Commonwealth of Virginia was somewhere $3+ billion. And it was up to the Commonwealth to decide how that was distributed throughout the localities. They did a formula based on population. And made appropriations to localities based on our representative share of the state's population. That came out to $20 million for this tranche. There will be a subsequent tranche of funding that comes in the fall, and we hold out greater hope that the federal government comes together to loosen restrictions on money that's already been awarded, and then finds the ability to provide more resources for states and localities. Because what we got right now, the 20 million, is solely devoted to direct impacts related to COVID-19. So when you think about all of the money that is being spent on PPE, the money that's being spent to not have people evicted from their homes and provide emergency financial assistance for people who've become and underemployed, when you think about the small business assistance to help them retain employees and not go under, when we think about contact tracing and further testing, which is going to be required a little bit later on, the expenses are going to add up real quickly. And we've already spent in actual dollars about half of the 20 million. And as we think about moving forward, our expenses are going to far exceed that. So the help will be needed for the federal government to step up even more.
I was just going to ask, does this have anything impact on the new budget for fiscal year 2021, or is this just kind of a emergency Band-Aid, so to speak?
Well, we hope it'll be a big Band-Aid.
Yeah. And unfortunately, Kara, the federal government has decided that this can't go to replace projected lost revenues. Right. So, our hotels are not functioning, and they're not going to be able to get up to speed as soon as the fiscal year starts in July. We know that our restaurants and bars and the meals taxes that they generate is going to be slow to return. This money can't go to solve any of those budget holes. It can only go to direct expenses. So a lot of the pain that localities are experiencing are going to come the next fiscal year when the revenues dry up. So we hope that the federal government finds a way to help with that.
Yeah. And that's part of the reason we're working so hard to try to make sure our businesses survive this, so that they're there to help us recover. Because if we let that all go, the recovery will be so much harder. I believe of the state money, I think some of that I think it's like 30, well, it was a lot of billions, that's actually still sitting, half of it is in Richmond, I believe. And the governor is not yet, and the legislature haven't yet decided how that's going to be distributed, whether it's going to be per capita or some other way. So we're watching that very closely, and paying a lot of attention to it. I was on a call with one of my colleagues in the region who is with the National Association of Counties, and we're hearing on a national call, apparently in the state of Texas, the state decided to keep all that money and not send it down to the localities. And they're in a real world of hurt trying to figure out how that works. So we're better off here than a lot of places.
Okay. We're going to take another short break now. And when we come back, I'll ask the board members about the actions they took in May that are going to help protect low and moderate income renters from eviction during this pandemic, to increase opportunities for testing for COVID-19 and improve health care for those low income patients. Stay with us. Welcome back to County Board Wrap Up. We're talking today with County Board Chair Libby Garvey and Board Member Christian Dorsey about the county's multifaceted response to the COVID-19 pandemic. And of course, one of the most difficult issues that the county is dealing with is how to keep people who've lost their livelihoods as a result of this, also keep them from losing their homes. Christian, we'll start with you. The county approved some rather unique loan payments here.
Yeah. So, we have a lot of ways of helping people who have been affected by losing or reducing, having their income reduced as a result of COVID. We have programs directly through our Department of Human Services, as well as a partnership through Arlington Thrive to provide direct cash assistance to people who are short on making their mortgage payments or who have had their income totally reduced. If you are an eligible low-income Arlingtonian, you're eligible for that cash assistance, and we have added substantial amounts that are available to meet these unprecedented needs. But then we also thought, well, how can we further help people? And our staff came up with an innovative way of leveraging the loans that we make available for nonprofit providers of affordable housing and presented them with a win-win scenario. You're all having difficulty making your mortgage payments when tenants are late or behind on rent. So why don't we allow you to not pay loans, your monthly payment on loans until the end of the year.
We had a pretty good safety net here in Arlington. And so a lot of the structures were in place that as this pandemic has hit, we've been able to ramp them up. It wasn't like we were starting up with something we'd never done before. So we've always had grants, assistance to people to keep them in their homes. And I think as we go, we're going to be having discussions about this, I believe, as a community, because this is going to be a major part of our budget, I think, for a while. But of course, while it's expensive, it's really not nearly as expensive as if all kinds of people end up out on the street because they don't have a home. So I think it's not only the right thing to do, I think it's actually better for our community. But we'll be having more discussions about it. And we do have that, again, this variety of ways. Sometimes we support the property owners that we're our nonprofit partners that are managing these apartments, so that they don't have to worry so much about not getting the rent in. And then for the folks that they're private owners, we're trying to help through the grant program that we've had people to actually pay their rent to them so they can pay their mortgages.
Right.
So,
right.
Yeah.
Kind of turns into this whole circle.
It's a circle, and when we keep it going, it can be functional and good for everybody. Mm-hmm.
Well, of course, another area of concern for especially some of the same audience is healthcare. For many in our community, losing that job means also losing that health insurance, which is, pretty scary when you think about it, especially in a time of a pandemic. And we've seen a big increase in the need for the Arlington Free Clinic for the healthcare needs from that service. And in this past month, you took a step designed to strengthen that clinic's ability to serve patients. Tell me a little bit more about that.
Absolutely. So we have this ConnectArlington, which is this fiber that we've put in the county, allowing high internet speed connections. And what we did is we made an agreement with Virginia Hospital Center and the clinic, and they are now connected directly so that they can easily records can go back and forth, and information and testing information, or do some telehealth where there's some issue, somebody's presenting and the doctor can, use it, diagnose and prescribe virtually. So we've done that to connect it up, which is really good. And besides, as you mentioned, people losing their jobs and losing their health insurance and how terrible it is. But we have a lot of people who just never had health insurance, or they may have lost their jobs, but that job never provided health insurance anywhere. So we're having a lot of issues to deal with that. This pandemic is showing so clearly problems in our society. And we're now realizing that by not supporting people in some very basic ways, it actually harms all of us. So hopefully, again, as we said earlier in this broadcast about some other things, I hope we're going to end up coming out in a better place in the end, because healthcare is certainly one of those areas that needs work.
Okay, well, we are going to take another quick break. When we come back, we will wrap up with a look at some much needed additional funding that the board approved for the grant program for small businesses. We'll be right back. Welcome back to County Board Wrap Up. We're talking today about the various efforts the board took to help during this COVID-19 pandemic. And a big part of that, as we've been discussing, was the effect on Arlington's business community, specifically our small businesses. And now the county's stepping in with the Small Business Emergency Grant Program. Let's talk a little bit about this. Christian, we'll start with you. Tell us why the county decided to establish this grant program and what's the goal?
Well, there are lots of opportunities that may be available to small businesses who are impacted, but those are largely going through commercial banks, and they have huge lead times, and not all businesses are eligible. And when we look at the businesses, some 6,000 small businesses in our community, we know that a number of them need assistance much more quickly, and they need it with less red tape. So thankfully, our Department of Economic Development came up with a way to really, in a streamlined fashion, determine eligible businesses who would be well qualified to receive a grant so that they could devote those resources into meeting the necessary expenses and hopefully reducing layoffs. And fortunately, the amount of money devoted to the program has grown from around $700,000 to over $1.2 million. And that will help because we've had over 1,000 businesses who have applied. And we're not going to be able to help out all of them, but hopefully we can sufficiently and provide grant funds so that they can keep employees employed. They can assure that they're going to be around when we can reopen as a community. And then hopefully we can find more resources to help even more small businesses.
Yeah, this was a very positive thing for me. I felt when it came up, because first our staff came and said, let's repurpose. These were grants for something else for startups. Let's put that to helping small businesses. And that was about a little under $700,000. And, and I thought, that's smart. That's innovative. That's great. And then we got IDA funding, I think it was, that came in and got it up to like $1 million. And I'm thinking, okay, good. And then we had our bids. Our business improvement director put in more, and that now we're up to 1.2 million. And it's really a feeling that everybody's kind of seeing what the problem is, and everybody's stepping up to help. And that's a good feeling because we all need to be helping each other and help get these businesses through.
And these were designed specifically for Arlington's small businesses.
Oh, right.
Why was that, would you say?
Well, the big guys are much better off, I think. You're the economist, Christian.
Yeah. Well, we did a survey. Department of Economic Development did a survey, and they looked at businesses, large and small, local, national, and really tried to assess what are their issues and needs and concerns. And we certainly found that the size of the organization is very much correlated to whether or not they've suffered extreme issues during this COVID-related pandemic. So we knew that we wanted to focus on the small businesses of 50 or less, not the federal government's 500 or less, right? We're talking true small businesses. And, it doesn't take an economist or a rocket scientist to know that there's so many restaurants and coffee shops, cafes and boutiques and tchotchke shops in Arlington that could very much benefit with this critical lifeline of being able to get resources to maybe meet any lease obligations or to maintain the staff who can allow them to do curbside pickup and maybe delivery, or to just be available for when they're ready to reopen. So we wanted to focus on where the money could do the most good, and that is allowing these businesses to maintain continuity, but more importantly, to not go under when we're ready to reopen.
Yeah. And as Christian pointed out at the beginning, a lot of times the companies have to have, for the federal money, a relationship with the bank, right?
It's true.
And some of these small businesses, they don't. And they might work it out, but they can't survive that long. So it's a bridge, really. It's to get us across to the other side.
Yeah.
All right. Well, that sounds like a perfect note on which to wrap up. Libby and Christian, thank you both very much for giving us some insight into how the county's responding to the pandemic and when Arlingtonians can start to perhaps see a light at the end of the tunnel, so to speak. I'm Kara O'Donnell. This is County Board Wrap Up. We look forward to joining you again next month with a look at the board's actions in June. Until then, stay safe. We'll see you soon.